If you have really bad knee pain or poor knee mobility as a result of joint osteoarthritis, then the 3 exercises in this video are going to help you. Hi everyone and welcome to Exercise for Health, and in today's video I'm going to show you just 3 exercises you can do every day that will reduce knee pain whilst also improving your mobility and functional ability for activities of daily living. These are beginner exercises suitable if your osteoarthritis is pretty bad and causing you real major problems, and if done consistently could help offset the immediate need for surgery such as a knee replacement. Many people I've seen with osteoarthritis in the past question whether exercising the joint will actually make it worse, especially when they've been told their knee is a wear and tear condition. This term, however, offers a poor description of osteoarthritis because it's more common in people with sedentary lifestyles than it is in very active people. Regularly moving the knee in a way that it's designed for, like walking, standing up or sitting down, helps promote joint health and longevity. Therefore, when it comes to osteoarthritis, think motion is lotion and use it or lose it. By doing less and putting the knee into prolonged periods of rest, it will be subjected to accelerated degeneration, making it worse. Hence why stretching and strengthening exercises for the muscles that act upon the knee are well documented as the best osteoarthritis treatment that's non-drug related. So although exercise can't reverse arthritis, it can provide a suitable form of management of the condition. Before I explain the 3 exercises, it's important to ensure that you perform these exercises within a pain limit of 0 to 5 on the 0 to 10 pain assessment scale, so within the realms of minimal to acceptable pain. You'll also need to monitor how your knee feels after the exercises, both immediately and the following day, as this will be your barometer as to how and when you can progress. If your knee pain feels worse the day after, then you'll know you'll need to scale it back. If it feels okay, then maintain or progress it in a very slow and conservative manner. I will also be demonstrating the exercises with a red band around my right knee, which is just highlighting the arthritic knee for your reference. The first exercise which I recommend you start with is a stretching exercise to mobilize the knee joint by working through its extension, which is trying to get the knee to straighten, and its flexion, which is trying to get the knee to bend. The severity of your knee arthritis will depend on how much movement you get, but don't force it too much, so you stick within your pain limits of 0 to 5 on the scale. To do the exercise, start with the heel of your foot up on a cushion, foam roller, chair, table or whatever you have at home that's comfortable and creates a space under the knee joint. Then think about trying to straighten the knee, gently assisting with the hands if necessary, and hold for a count of 5 seconds. Then lifting the foot up and bringing the heel towards your bottom, grab the bottom of your shin and gently pull it closer to bend the knee more, and again hold for a count of 5 seconds before returning to straightening the knee again. Repeat this mobilization stretch 5 times each way initially as a guide, but if you don't experience worse symptoms the following day, you can begin to increase this number. This can also be done more than once a day as you're trying to improve the joint mobility, so the more regular you are with moving the joint, working within your limits, the greater the long-term beneficial effect will be. The second exercise is the first of 2 strengthening exercises, and that is the partial weight-bearing squat. You will need a support for this one to rest against while in a standing position, and the aim of this exercise is to stimulate the muscles that act upon not only the knee joint, but the hip too, which can help reduce knee pain in the long term. It's important that some of your weight is taken through your arms, but over time this can be reduced so more of your body weight is placed through the legs. In addition, the depth of your squat may feel restricted based on your level of pain. Just starting with a shallow squat, so not even getting to 90 degrees, may be all you can manage, and that's okay. It will still stimulate the muscles that act upon the knee to help strengthen them. Ensure that your lowering phase is performed slower than your standing phase, as this will add to the strengthening effect. Also be sure to keep your knees the same width as your feet at all times throughout the movement, and if you're really struggling with the knee pain as the joint begins to bend, push your bottom back more, which will shift your weight back to the heels of your feet. Although this is not how it should be performed in the long term, it may be a way to stimulate the muscles without excessive knee pain being a barrier to performing the movement. Over time, as you repeat this exercise every day, the goal will be to either increase the range of motion, in other words squat lower, or to decrease the weight you're supporting with your arms until you can practically do a full weight bearing squat. In terms of the number of reps you do, I would say ideally somewhere between 10 and 20 in a controlled manner, but it should be quality over quantity. If you can only manage 2 or 3 reps before the pain rises above a 5 on the scale, then this is your start point, and focus on building the number of repetitions first before increasing the range of motion or weight through the legs. Just doing 1 set per day will be enough initially, but you could increase this to 2 or 3 sets if you find it manageable. But remember to see how you feel the day after to ensure that you don't overdo it. The final exercise is a step up. This uses a smaller range of motion in the knee compared to the squat, but it will place more of your body weight through one leg as you move up and down, making it more challenging. Start with a low step near something that you can use to hold onto for support purposes, and begin by using your non-affected leg to lead both up to the step and down from the step first. This will provide stimulation for the muscles around the affected knee as you lower back down when it's taking your weight. To progress, use the affected leg to lead up to the step and use the non-affected leg to step back down. This method is harder, but will work the affected knee on both going up to and coming down from the step. If both knees are as bad as each other, then it won't matter which method you use. However, just make sure you balance the movements on both sides. For example, you could perform 5 step-ups leading with the right foot and 5 step-ups leading with the left foot to make up your set of 10. If you can do 20 step-ups without any issues, then you can progress by increasing the height of your step or decreasing the level of support until you are full weight bearing. Again, as with the squats, 1 set will be sufficient initially, but you could build up to 2 or 3 sets. Just make sure you monitor your pain the following day so you know whether to maintain, progress, or even regress how much you do. I hope these exercises help improve your knee mobility and reduce pain. If you found it useful, please give it a like by clicking the thumbs up button below, and consider subscribing if you haven't already. You can check out the description below for further information and links to other videos that I've done for the knee. But thank you so much for watching, and until next time, stay active and keep moving to feel better.